The AIDS movement was a huge movement where their main goal was to find a cure for AIDS and to help those suffering with the diagnosis of AIDS. But I've always been curious and started to wonder, how did the movement and protest progress AIDS research and further people's knowledge of AIDS? The movement progressed AIDS research by forcing the government to pay attention to them and speed up the research process. They also shared information on the spread of the disease. In order to prove my thesis, I decided to look at why the patients needed to go as far as protesting and marching to find a cure for this disease, and why they were the ones that had to teach others about AIDS. You'd think that a disease killing thousands of people would have had an enormous government response, as most of you lived through a pandemic and saw the response to what happened when COVID-19 came to the U.S. You'll be shocked to learn that the AIDS epidemic was first ignored and minimized, even though it's the government's responsibility to do as much as they can to keep all of their citizens safe. After doing some more research and beginning to read about this time period when AIDS came out, I learned that the government was not doing their responsibilities was largely due to the fact that the communities who were directly affected by AIDS were communities such as people who are homosexual and people who are black, which were already discriminated against and therefore not represented in the government. Because of that, it was harder to make their voices heard by the people who could help them the most, which are the government and health officials. This is according to Progress Through Innovation and Activism. According to Howard Markle, another problem was that during this time period, there was so much misinformation about how the disease spread that people with AIDS were avoided and thought to be infectious, which made kids feel left out in school and everyone else with AIDS feeling left out in the world and forgotten about. Now, some of you may be wondering, what did the gay community do to try to achieve their goal? There are many strategies that they used. One of the forms of protesting that they used was disrupting traffic, according to Sarah Schulman. This was a very effective because they disrupted people's lives and forced them to listen to their cause, while also forcing the government to hear them because of all the chaos they created. There are some other strategies that the movement used to educate people on the topic and help patients is offering free lessons on AIDS. Groups like GMHC, ACT UP, Latino Commission on AIDS, and Black AIDS Institute offered free education for the people in their communities. These organizations supported the spread of correct knowledge and tried to destigmatize how AIDS spread by bringing awareness to more people. This type of resistance is as useful and as impactful as protesting. When we can teach a person how to prevent the spread of AIDS, that information can spread to other people, which makes a difference. AIDS organizations also help the poorer communities who were at high risk for AIDS by giving them free housing and preventing them from sharing dirty needles. But by helping these types of communities, it would prevent the spread of AIDS. This is according to Tassim Padviz, HIV/AIDSawareness.com, Prezi.com, and Mikhail Tah. Fortunately, the movement was a success, and they did get the government's attention, especially after President Reagan's term was up. An example of the government helping with AIDS research was when the San Francisco government opened an office dedicated to AIDS research in 1983. This was crucial because San Francisco was one of the cities that had the most cases of AIDS. The office grew from 9 employees to 100 employees 14 years later. During that time, the office also went from receiving $43 million in funding to $73 million, which shows that over time the government became more aware of the disease and the fact that they were responsible for curing it, according to Mitchell Katz. On the federal level, the AIDS movement convinced the government to help AIDS patients in many ways, such as giving them the rights of disabled peoples, which made the treatment that they received free. Additionally, the protest forced the FDA to quickly approve more medicines such as Saquonivar, Ritonavir, Indonivar, Neflonivar, Didonivar, or Dilanacine, and Zalactibine, which were critical in ending the pandemic and preventing even more spread and death for future to come. This is according to the impact of HIV research on health outcome and healthcare policy. New research and medicines to help those diagnosed with AIDS today is ongoing, and there have been many advances over the years. So to answer the question, the AIDS movement disrupted the public to get the government to realize that it was the right of the people to get health care and that they were responsible for providing it. They also helped to fight the disease by offering free information to make sure people know about how to not get infected. I have also learned through the research that I did that the AIDS disease is not over, and we can't stop fighting until there's a full cure for the disease.